Hi, my name is Stephanie Dillon. I'm in Section 4 and I'm going to be demonstrating IV piggyback. The doctor has ordered 1,000 milligrams of Rosepin. I have available with me 500 milligrams per milliliter. Rosepin infuses over 30 minutes. I have a 50 milliliter bag of solution and the drop factor is 10, so I will be having a drop. I'll have 17 drops per minute of Rosepin over 30 minutes. So what I'm going to do now, after ensuring doctor's orders and any allergies the patient might have, and making sure that the 1,000 milligrams is a safe dose, I will go ahead and pull up the 2 milliliters. I'm going to be putting that directly into the solution. I will recap that and throw this into the sharps. I will mix up the medication into the bag, and at the same time I will label the medication bag with the client's name, the date it's being run, the time it's being administered, my initials, and the medication that it is, and the dose, if I didn't already say that. Okay, so after that, I'm going to attach the tubing to the bag, maintaining sterility. Okay, and now I would go into the patient's room. Hi, how are you? My name is Stephanie. The doctor has ordered Rosepin 1,000 milligrams. It's going to be infusing within the next 30 minutes. This time I'm going to prime the tubing. That is correct. I would also label the tubing with my initials, date, and time. So I'm going to hang the piggyback, and then I'm going to lower the primary. I'm going to assess the IV site, making sure it was fine. And then I'm going to clamp off the primary line. This time I will be doing my hand hygiene. I will be putting on my gloves. Okay. And now I will choose the port that I will put the medication in. I'm going to put it to the port closest. So what I'm going to do is clean off the port, and I've already clamped the primary line. I would clean the port, take the alligator clamp off of the tubing, and attach the tubing to the primary line. And at this time I'm going to prime the drip chamber about halfway. I'm also going to establish the flow rate of 17 drops a minute. I will be counting for 30 seconds, making sure that I get about 8 or 9 drops to ensure that I get 17 drops a minute. Okay, and at this point I will take off my gloves and do hand hygiene. I will let the patient know that I will be back within 30 minutes because that's how long the medication will be infused for. And I reassess the site for any immediate reactions, and I ensure the patient is comfortable, their pain level is low. I will make sure that they have to potty or not, and I will make sure their personal belongings are near them. With that being said, I'm just going to go ahead. I'll come back in 30 minutes, reassess my site, make sure that the medication has infused. I will do my hand hygiene again, and put on another pair of gloves. Okay. I'm just making sure that the site is free of phlebitis or infiltration. And then I'm going to go ahead and shut off the secondary and unclamp the primary, making sure that is back in order. I will put the primary back in its place. And I will reassess any signs of any infiltration or phlebitis. At this time, I'm going to make sure that the primary line is running okay. I'm also going to make sure the patient is comfortable, has to or needs to go potty. I'll make sure the personal belongings are near them as well as the call bell. And I will assess their pain level. And at that point, I will leave the room and document. I will document the medication dose, the route, which is IV. And I'm also going to record the volume of the medication which was infused and record that into input and intake and output. And that should be it.